computer. Welcome 180 Degrees consultant members and PwC associates and directors. Team Safe Haven is delighted to present our proposal to the homelessness in Pittsburgh case. Our group members are Tiffany Zhang, Lauren O, Somali Junthala, and Kathy Liu. This is the agenda for this presentation. We will first start off with the executive summary, and I'll hand it off to Tiffany.
Good evening, everyone. Given the prompt, we know that Pittsburgh declared a health emergency of homelessness in January 2023, and the Pittsburgh City Council is looking for long-term and short-term solutions. The question is, how do we strategize to find these solutions to this issue? We know that the homeless population has been increasing due to the lack of affordable housing and social welfare programs that are needed to help them integrate back into our society. Thus, introducing our Triple R solution, repurposing vacant spaces, revising policies and perceptions, and reintegrating back into our society. Through the 3 Rs, Safe Haven will provide a detailed blueprint for resolving this public emergency. We first must understand what is homelessness. It is living without a nighttime primary residence, and this includes individuals who live without stable housing or those who are staying in places that are not safe or designated for living. We also have to understand the statistical analysis of Pittsburgh. 913 of 300,000 Pittsburgh residents are homeless, and this number has been increasing since 2018. The cost of living is about half of the average income. These stats are important as they will help the City Council understand our Triple R solution. First, Safe Haven plans to repurpose vacant spaces in our short and long-term plan. For the short term, Safe Haven plans to reuse shipping containers. When the COVID pandemic hit in 2019, there was a shipment container shortage due to the market shift to online shopping. Thus, the overproduction of containers led to a 13 million extra containers that are unused globally in 2022. Major cities like New York, California, Texas, and Louisiana allow shipping containers homes, and each shipping container will take less than $15,000 to transform into temporary shelters in less than 2 months. In the long run, Safe Haven plans to repurpose abandoned steel infrastructures around Pittsburgh into affordable housing. Currently, over 13,000 spaces, including steel infrastructures and houses, are vacant. We projected that this project will cost about $500,000 to $14 million, depending on how many we will need in the future.
Our second solution of our Triple R is to revise policies and perceptions. So, according to KDKA News, the current situation is that shelters and federal aid is not enough to end homelessness in Allegheny County. So, we propose using the current budget to focus on the House First program. The idea of housing first is the house comes first and the services come later. The implementation of the Housing First program is a critical initial step for the process of reducing homelessness. So during a 10-year span from 2005 to 2015, by implementing this process, Salt Lake City, Utah has reduced the number of homelessness from nearly 2,000 people in 2005 to fewer than 200 in 2015, which is approximately a 91% decrease in homelessness. So we are pushing for Pittsburgh to continue forwarding with the House First program while also using Salt Lake City as a guideline.
Currently, homelessness is often stigmatized with criminalization, threat, and violence. Homeless people are treated without respect for basic human rights. However, the truth is, many are diligent people who face unfortunate and uncontrollable circumstances. This prejudice not only leaves deep scars in their hearts, but also prevents them from re-entering society. In order to revise these negative perceptions against homeless people, we suggest that corporates include homeless awareness education in their recruiters' DEI training. Since numerous companies exist in Pittsburgh and those companies are where homeless people should eventually re-enter, including the training would gradually open the doors for the homeless people.
Our third solution is reintegrating them back to society. The Substance Abuse and Mental Health Services Administration provides the data roughly 38% of homeless population suffering from alcohol dependency, while 26% abuse drug. Additionally, they found that 68% of cities report that substance abuse were the largest cause of homelessness among the single adults. Substance abuse is a big issue for the homeless, but their health needs are broader. The healthcare systems in the challenging and the cost of helping them firsthand. For homelessness in Pittsburgh area, we can work with the existing program like UPMC Family Contive, Pittsburgh Mercy Family Health Center, and the Center of Inclusive Health. In fact, homeless people are often frequent users of emergency room. They visit ER an average of 5 times per year at a cost of $3,700 per visit. This individual require average of 3 nights in hospital per visit at a cost of over $9,000. 80% of the emergency room visit made by people struggling with the homelessness are for an illness that can have been treated with the preventive care.
Food and health are very closely related. Depletion of nutrients can hinder the efforts of homeless people to improve their quality of lives, such as reducing drug and alcohol consumption. According to National Library of Medicine, urban homeless people have obtained far lower dietary adequacy score of 10.1 compared to the norm, which is 16. Therefore, we suggest partnering with homeless shelters with 412 Food Rescue. It is a nonprofit organization that redistributes local fresh food surplus that could have been wasted otherwise. It partners with several businesses, including Giant Eagle, Whole Foods, and Trader Joe's, to provide for communities suffering from food insecurities at cheaper prices. Connecting with 4112 Food Rescue will provide consistent, sustainable, fresh food supply for those who do not have much access to healthy options.
A service provider in California highlights the challenges that many homeless individuals face when seeking stable employment. While some of these challenges like discrimination, logistic, and need of an address are invent, there are deeper challenges in the hiring process that might not be obvious. First, educational requirement can be a significant barrier. Not everyone has the chance to complete their education, especially for the homeless, which can limit their job opportunities. Many homeless individuals require assistance to develop essential skills to qualify for jobs. In our strategy, we will cooperate with local charities and the church to open up job opportunities, especially for those without a stable home and job. However, many of these individuals currently hold jobs with insufficient pay, which makes it challenging to meet daily needs. We plan to have skill enhancement training programs for preparing them for higher paying jobs in the future. Additionally, current educational support largely focus on younger homeless individuals. We will expand the age criteria for those programs, ensure the diverse age group will be able to access the education, enhancing their understanding of their situation and help to rebuild their lives.
These are the short-term timelines. For the first 12 months, we will start reaching out to organizations to partner with and gather materials for temporary shelters. For the long-term goal timeline, we will be implementing these housing acts and expanding the homeless education and performing KPI checks every 5 years. The house will be built by the 10-year timeline, and another KPI check will be done at the end to check our progress.
So according to the Pittsburgh Budget and Policy Center, this is a current breakdown of the budget meant to address homelessness. So 1.2 million is for local organizations, 3 million is for food insecurity, and 12.8 million is for the House Opportunity Fund. And with other costs, it's an overall budget of 40 million. So the shipping containers, based on like previous cities that have used the shipping containers, such as New York City, San Diego, and Dallas, it's about 15K per container. And since it is a short-term solution, it's 2K per year for the next 9 years. Infrastructures based on New York City, who have been doing a renovation project of old buildings into new buildings, have used a breakdown of $200 to $400 per square foot, and that's for the next 9 years. for a total of 10 years. The House First program uses about 16.4K, and this is based on previous places that have used it, such as Salt Lake City and Houston. And the awareness training is 50K, and since it is done like every 5 years, we haven't considered it for the years in between. Stability services, we've said about 200K for healthcare, and 1 million for food security per year. So current key performance indicators is that for short term, we've said partnering with university students, and then also reducing program length of stays, reducing the length of the time that they're homeless, reducing returns to homelessness, and aim for a 20% decrease in the number of homeless population. So long term, we are hoping for a prevention of new episodes of homelessness, developing and implementing a sustainable and scalable housing model, focusing on housing stability and access to resources without shelter stay, and aiming for a decrease in homelessness by 60%. So the impact, KPBS News reports a nonprofit returning shipping containers into homes for the homeless in San Diego, which highly populated area for homeless people. And this has reduced the cost of traditional housing into much easier by saving a lot of more money. And the founder of the Housing First philosophy has also claimed that chronically homeless people cost the government a lot more money when they're living on the streets because of services like emergency room visits and jail time. So the Housing First program will naturally save costs for the program as well. The space is also saved as the shipping containers are stacked on top of each other and have medical assistance to open to them as the shipping containers were on top of a medical facility. These shipping containers have proved to be much more affordable, so owners can cut down on labor costs and reduce carbon footprint, which is a win-win situation for many. And Phoenix is also a case of new modular unit called the X-Wing, designed in the shape of an X, so it can sleep up to 20 people in a room, reducing the space. So some of the risks and mitigation is, despite the high costs, our plan is that, according to CBS News, the City Council has 40 million per year to use for homelessness. But the issue is that the budget has not been effectively used and can be more properly used by the idea of the House First program, by providing houses first and then services later. And the second risk is the use of shipping containers. But since they can be rented out once their use is over for homeless for homeless people, it is also a win-win situation for the owners as well. And that's it. Thank you for listening.